Here's my ID. And we're gonna scan the room. Okay, so the first thing that I would do is make sure that I had a non-distracting, quiet environment to do my medication administration. So I would limit all conversation with colleagues. I wouldn't take any phone calls or look at my phone. I would shut all the doors to the room, and I would follow my hospital's no interruption zone policy. Now what I'm going to do is directly compare my patient care order form to my medication administration record, and I'll show you those real quick. And this is the MAR. And I'm going to be going through the 7 rights first. So the first one is the right patient, Jaguar J. Jones. Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, MR number 4176352, MR number 4176352. So we have the right patient. The next thing is going to be the right drug. So morphine sulfate, the right dose, 5 milligrams, 5 milligrams. The right route, which is IM, intramuscular, IM. The right time, which is every 4 hours, every 4 hours. And the right indication, which is PRN for pain, and PRN for pain, which is as needed. Okay, so the next thing I'm going to do is move over here and perform hand hygiene. I'm going to select the correct medication, which is morphine sulfate. Okay, so I'm checking the expiration date first, which is 12/20/2025, so it is in date. And now I'm going to directly compare this to our MAR. So first, the name of the drug, which is morphine sulfate, morphine sulfate. Time is every 4 hours. The patient hasn't had the drug in 4 hours, so it is the right time. The route, which is IM, so for IM, I'm going to select a 3 milliliter syringe, a plastic blunt cannula, and a 23 gauge needle. Okay, and I'm also going to be checking the right dose, which is 5 milligrams, and I'm going to calculate how much I would need in my syringe. So my vial says there's 10 milligrams per 1 milliliter, and I need 5 milligrams, so that means I would need a half of a milliliter. I would have a colleague come and double check my calculations, and then I myself will double check my calculations. So 5 milligrams is what the MAR says, and there's 10 milligrams per 1 milliliter, so that means I would need 0.5 milliliters or a half of a milliliter. So now I'm going to move on to drawing up my medication. I'm going to start by cleaning the top of the vial. Okay, I'm going to take out my syringe, take out my blunt plastic cannula, twisting that on tightly. Okay. All right. The next thing I'm going to do is inject a half of a milliliter of air to inject into the vial. So that's half of a milliliter of air. Okay. So I'm removing the cap, placing that down, placing this into the vial, injecting the air, and now I'm going to inject this. I'm going to do it a couple times so I know that there's no air bubbles. So I have half of a milliliter of morphine sulfate. So now I'm going to take the syringe and the vial and directly compare that to the MAR and go through the 7 rights again. Okay, so the first thing we're going to do is the right patient. So Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963, MR number 4176352, MR number 4176352. Then the right drug, which is morphine sulfate. I have morphine sulfate here. MRA also says morphine sulfate, and I put morphine sulfate into the syringe. Okay, the right dose, which is 5 milligrams, 5 milligrams. I have half of a milliliter. I have half of a milliliter of the morphine sulfate, which is equal to 5 milligrams because the vial says 10 milligrams per 1 milliliter, so half would be 5. Okay, also the right route, which is intramuscular and intermuscular, or IM. The right time, which is every 4 hours. Every 4 hours, the patient hasn't had the medicine in 4 hours, so it is the right time. And the right indication, which is PRN for pain, or as needed. I'm checking the allergies, which are they are allergic to penicillin and penicillin. So now I'm going to recap this one. Okay, I'm going to set this down and I'm going to create the label now. The label is going to consist of the patient's name, the drug that's being administered, and the dose of the drug. So, Jaguar J. Jones, morphine sulfate, and 5 milligrams. Okay, so I'll show this to you real quick. Okay. And I'm going to place this onto the middle of the syringe without covering up where you can see how much medicine is in it. And at this point, I'm going to take off the blunt tip and I'm going to place the needle on there. Without touching it. And I'm also going to place the blunt tip cannula into the sharps container. Now what I'm going to do is take my syringe and my vial and my MAR and move to the patient's room. So into the patient's room now. I'm going to set this down first. I'm going to perform hand hygiene, and then I'm going to identify the patient using the 2 identifiers on the armband, which is right here, and also with the allergy band as well. So Jaguar J. Jones, and this is matching up to the MAR. Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963, MR number 4176-352, MR number 4176-352. And the allergy band says penicillin. The MAR also says penicillin. And at this point, I would ask Mr. Jones, are you allergic to anything else that I need to be made aware of? And he said no. So now I would begin my administration assessment, which consists of measuring the blood pressure, the pulse, and like a pain scale or a pain assessment. Okay, and then after that, I'm going to do my last check of accuracy for the 7 rights. So I'm going to take my syringe with the label and the vial, and I'm going to directly compare all of these one more time. So the right patient, Jaguar J. Jones, Jaguar J. Jones on the patient care order form, Jaguar J. Jones on here. Date of birth 8/25/1963, date of birth 8/25/1963. MR number 4176-352, MR number 4176-352. So we have the right patient. Next thing we're going to look for is the right medication. It's morphine sulfate. This is morphine sulfate right here. I have morphine sulfate in here. And the patient care order form also says morphine sulfate. The dose is 5 milligrams. I have a 1/2 milliliter of morphine sulfate in here because my vial, once again, says 10 milligrams per 1 milliliter. So that would mean I need a 1/2 milliliter to be 5 milligrams, which is what I have. The route, which is intramuscular, and I have the correct needle selected for intramuscular. The time, which is every 4 hours, and it has been 4 hours since Mr. Jones has had his medicine, so it is time for it again. This also says every 4 hours, and the indication, which is PRN pain, which is as needed for pain, and this one also says PRN pain. Okay, so from here, I'm going to set this down. and I'm going to explain the procedure to Mr. Jones. So Mr. Jones, I'm here to give you your pain medication, if that's all right. And I'm gonna raise his bed up and lower the side rail. And then at this point, I'm going to don my clean gloves. Okay, now that I've done that, I'm going to put my goggles on. Okay. And now I'm going to be assessing the integrity of the skin, and I'm going to be, the location that I'm going to be using for the injection, I'm going to be finding that with the bony landmarks. So I'm assessing for any bruising or anything like that, and there is none. So now what I'm going to do is I'm going to clean the area with an alcohol prep pad in a circular motion, like so. Okay, and now that I'm done with that, I'm going to grab my syringe. I'm going to take the top off of my syringe. Okay, I'm going to spread the skin, since this is intramuscular and morphine. I'm going at a 90-degree angle. I'm going to aspirate for blood, and there is none, so I'm going to slowly inject the morphine. And I'm going to pull this out. I'm going to put this into the sharps container. Okay. And then from here, I'm also going to apply pressure after giving the injection, just slight pressure. And then from there, I'm going to assist the patient to make them more comfortable, raise the side rail, lower the bed back down, and then I'm going to, let's see, observe the patient for any adverse reactions or anything immediately. I'm going to take my gloves down, off, facing the trash can down. I'm going to perform hand hygiene, and then I would go and I would document how the patient tolerated the procedure overall, and then I would come back to the room in approximately 30 minutes to observe the patient again, and that's it.